Malaria is a vector-borne disease that is transmitted by the female Anopheles mosquitoes. It is one of the infectious diseases that is creating a high burden of morbidity and mortality in Africa. Malaria is one of the major concerns of the World Health Organization, and a lot of work has been put in place to develop and implement tools that are effective to fight against this disease, either to control the disease or to eliminate the disease. These goals are either by tools that are targeting the parasite responsible of malaria or the mosquitoes that are responsible of its transmission. Hence, tools like diagnostic tools, prevention tools and treatment tools has been developed and were used for the past decades, leading to a drastic reduction of the burden of malaria. Unfortunately, all the tools that we have at our disposal show some limitation. We are now facing challenging time where progress made the past 25 years are being jeopardized because of the climate change bringing the mosquitoes, the new mosquitoes, because the emergence of resistance available drugs, because of the apparition of malaria parasite not detectable by rapid diagnostic tests, because of the behavioral change of the mosquito transmitting malaria. But as researchers at the Kumasi Center for Collaborative Research, we are committed to fight malaria. For this, we are working alongside the National Malaria Elimination Program in Ghana. We are monitoring the efficacy of existing drugs to ensure that the resistant parasites are not yet in Ghana. We are testing new antimalarials to provide new solutions in case the resistance appears. We are also trying to understand better the dynamic of the disease in our local communities. What factor can influence the transmission of the disease? For example, what are the impact of comorbidities? How the immunity develops in newborns, and what are the factors that make some children more susceptible to malaria compared to others? How new tools like vaccine or chemoprophylaxis are effective in our population.
Malaria, we have come a very long way in this country. I mean, to the point that we've set for ourselves very ambitious targets. By 2028, we expect to eliminate malaria from 21 districts which have low malaria transmission. We expect to reduce malaria case incidence by 50% by 2028. And we are looking forward to reducing malaria by 90% in terms of case incidence by 90%, reference to the 2022 data. These are quite ambitious, even though we believe that it is possible. It is time that everyone get involved. The NMEP alone, the National Malaria Elimination Program alone, will not be able to do this. But if every individual becomes responsible toward preventing the malaria, we should be very good towards eliminating malaria in our country.
Malaria ends with us, and more now than ever, we shall reinvest, reimagine, and reignite to fight once and for all this deadly but yet preventable disease.
Malaria ends with us.
Reinvest, reimagine, reunite.